Welcome to the latest edition of Women's Health Updates, covering breakthroughs in the past 2 weeks. Brought to you by Lucid Quest. AstraZeneca and Daiichi Sankyo report that Enhertu significantly improved invasive disease-free survival versus TDM1 in the Phase 3 DESTINY-Breast05 trial for early HER2-positive breast cancer with residual disease after neoadjuvant therapy. Overall survival is immature, and safety was consistent with the label, with data to be presented at ESMO 2025. The FDA approved Eli Lilly's Inluriyo, imlunestrant, for adults with ER-positive, HER2-negative, ESR1-mutated advanced or metastatic breast cancer after at least 1 line of endocrine therapy. In EMBER-3, progression-free survival was 5.5 versus 3.8 months, hazard ratio 0.62. It is an oral, once-daily ER antagonist. Common adverse events were mostly grade 1-2. The label carries an embryo-fetal toxicity warning and notes CYP3A interactions. HHS and FDA will re-evaluate the mifepristone REMS after a request from 22 state attorneys general. Secretary Robert F. Kennedy Jr. and Commissioner Marty Makary will assess safety claims and possible modifications, including the role of telehealth and mail dispensing. The cited dataset has not been peer-reviewed. Unitide, CHAI and WITS RHI announced an agreement with Dr. Reddy's to supply generic lenacapavir for HIV pre-exposure prophylaxis at approximately $40 per year in 120 low- and middle-income countries starting in 2027, with the oral loading dose capped at $17. Aiming for a competitive multi-supplier market aligned with Global Fund and PEPFAR scale-up. Glenmark licensed Hengrui's HER2 antibody drug conjugate trastuzumab rezetecan, paying $18 million upfront and up to $1.09 billion in milestones for rights across select emerging markets outside the US, EU, Japan, and China. Rezetecan uses an exatecan-based payload, is approved in China for second-line NSCLC with HER2 mutations, and has a breast cancer filing under review. AbbVie plans to launch Elahere in the UK at a list price matching the US list price, subject to ongoing NICE discussions, potentially influencing pricing and formulary access in ovarian cancer. Galeon and Samsung announced native ingestion of Samsung ultrasound data into the Galeon EHR, including a free connector for each Samsung ultrasound device deployed in hospitals to reduce data silos and streamline clinician workflows. Google will pay $48 million and flow $8 million to settle claims related to sharing menstrual and pregnancy data for advertising between 2016 and 2019. Meta was found liable by a jury with damages pending. The settlement awaits court approval and the defendants deny wrongdoing. Plaintiffs allege violations under CIPA. Stay ahead in women's health research. Like, share, and subscribe for our updates. Visit elkventures.com or email us at info@elkventures.com for